Hello again, everybody, and welcome to another edition of Doc Talk with Monument Health. My name is Mark Houston, and when you've spent years caring for the men and women who serve our country, you learn a few things about resilience, trust, the importance of community. And joining me today is Dr. Joshua Larson, who knows all of this firsthand. He's a former military physician from Ellsworth Air Force Base, who is now part of Monument Health's growing team, bringing the same sense of service to his new role at the Box Elder Clinic. And today I want to talk to the doctor about life as a military doctor, what drew him to family medicine, and how this journey from the base to the clinic is helping shape the kind of care people in a town like Box Elder can count on. So, Dr. Larson, thank you for coming in here and doing this. I appreciate it.
Hey, no problem. I'm happy to be here.
Now, you're originally from Nebraska.
That's right.
But we'll claim you. I mean, the Dakotas, Nebraska, we're all one. Mostly, I think. How did this whole journey start for you, doctor?
Yeah, I started in Nebraska. I'm from Omaha,
okay.
As you said, so still the Midwest. It's about a 7-hour drive to get back home for me here. But, when you finish high school, deciding that you want to be a doctor, I think is a common decision that a lot of people make. Most of us want to help people as part of our career. So it started as that, and then, I don't think you can ever plan your route. So went through some unexpected career, changes and things like that. But ultimately super happy with where I ended up and happy to be serving the people of the Black Hills here. Did
you ever for a minute have any other I don't know, careers you thought about you might want to go into aside from being a doctor?
I think when I was 14, I came home and I said, I'm going to be a doctor one day. And my family was like, that sounds good to us. So I don't really think I ever looked back from that.
Really?
And that might be a little bit different than what most people have when they come into medicine. But for me, I think I just decided early on and never looked back.
Because a lot of people will have a family history of it, too. They'll have family members, grandparents that have been in the medical field. But for you to just kind of sit there at 14 years old, freshman in high school, and realize, wait a minute, this is something I want to do.
Yeah, absolutely. I wanted to, I always liked school. So I said, I can spend a long time in school. And then I did, 4 years undergrad, 2 years master's, 4 years of med school, 3 years of residency. So I didn't mind being in school. I liked it. I always knew I wanted to have a career where I could help people.
Yeah.
And if you Google what career can I help people in, doctor kind of comes up as the first one. So I was like, yeah, that sounds right. That fits.
Well, even the discipline that you picked, was that you just kind of wanted to go into because you're a family medicine,
that's
correct? Right. Was there any other path that you looked at in the medical field?
Yeah, I think when I interviewed for med school, they always ask you what kind of doctor you're going to be before you've reached out and experienced any of it. I think that primary care kind of always aligned with my values. Obviously, I looked into all these other specialties and things that I could do.
Right.
But when it came time to pick, I said family medicine really aligns with who I am, how I see myself as a doctor, the kind of relationships I want to have with patients. So it was a pretty easy decision for me.
Well, you've gone from, and we'll get into this here in a little bit too. But you've gone from an airman and their families, from working with airmen and families at Ellsworth, to caring for the community at large. What made you want to make that transition from the military to a place like Box Elder?
Sure. If I'm being honest with you, I would say when I decided I wanted to be a doctor, I did not decide I wanted to be a military doctor. That came a little bit later on. I got into medical school, and as soon as you get that acceptance letter, military recruiters start reaching out to you, and they say, hey, if you join the military, we'll pay for med school. Most people say, oh, no, thanks, that's not for me. But a lot of people say, yeah, that sounds like something I'd be interested in. But you look at how much medical school is going to cost, and the military says, hey, we'll pay for that. Just come be an active duty doc for 4 years. And that's really enticing for a lot of us. I wouldn't recommend anyone that thinks they might want to be a doctor just take that route to get their med school paid for. You have to want to serve and understand the unique needs of the military. But it's been a great route for me. I have no regrets about it.
Did you have any military background in your family then? I mean, didn't have any doctors? Did you have anybody in the military?
No, I didn't.
Man, you are the one.
Yeah,
in family.
Right. I said, yeah, no one else has done this before, but This seems like it's right for me. I did grow up across the street from a military base, Offutt Air Force Base in Bellevue, Nebraska, which is where I'm from. So I spent a lot of time around military families. A lot of my classmates were in the military and stuff like that. I always respected the way of life and wanted to find out more of what it was about. And at the end of the day, if the military pays for your med school, you owe them 4 years, which isn't forever.
Right.
So I was more than happy to do that time and get that experience. And it was a super unique experience.
Was there stuff you learned in the military that surprised you being a doctor?
Gosh, I don't think so. I think that people in the military have the same, anatomy and physiology as people that aren't in the military. So at the end of the day, patients are patients. There's some unique things that people in the military go through. When I started my career in the military, I was taking care of active duty members, and they're in general pretty healthy people. So we do a lot of performance stuff to optimize them as soldiers, airmen, warfighters, things like that. So there's a little bit of a different flavor of medicine, but at the end of the day, all those underlying principles are the same.
Did you get to spend any time overseas while you were in the military?
I did. It's kind of interesting how the military treats docs. You get your acceptance letter, you sign on the dotted line, you say, I'm going to join the military. They send you away to basic training pretty much right away before you even start med school. So you get to wear your second lieutenant bars because you're a commissioned officer, and you go to basic training. I think I spent 5 weeks there. Now it's up to 8 weeks. After that, they pretty much leave you alone. You do like a 1 month rotation every year when you're in med school, and they say your job right now is to go pass all your classes and become the best doctor you can, and when your training's done, we'll get a hold of you. So they got a hold of me. So I did my 4 years of medical school, my 3 years of my family medicine residency, I was going to graduate in July. I think February came along. I was like, I haven't even heard from these guys yet. I wonder when they're going to get a hold of me. And as soon as I thought that, of course, they get a hold of me the next week, and they say, hey, it's time to talk about your first assignment as a military doctor. They gave me some options to stay stateside. They didn't have anything open in the Midwest, which is where I'm from, and ultimately where I thought I wanted to live. And I figured, that's not super in demand. People are going to want to be on the East Coast or Florida or Hawaii or all these cool places where there's Air Force bases. But they didn't have anything open in Omaha, South Dakota, Wyoming, all those places that are kind of nearby where I grew up.
Yeah.
So the assignment officer, that's who decides where you go. He said, hey, I got a cool opportunity for you. We need a doc to go to Turkey for a year. And if you do that, you'll have your choice of all the assignments when you come back. They call it a follow-on. So I did that. I went and lived in Turkey from 2021 to 2022. And then when I was done with that, they said, all right, where do you want to go? And I said, South Dakota sounds good. He said, are you sure? I said, you could go anywhere. You can go to Germany, you can go to Hawaii, you can go to Alaska. I said, no, send me to South Dakota. I love it out there.
That is not where I expected that story to go. What was it like? I mean, because you're a Midwest guy. I mean, you're a Midwest kid. You're born and raised here, right? This is your neck of the woods, and now all of a sudden you find yourself in the Middle East.
Sure.
For a year.
Sure.
It was about a year.
Yeah.
What was that like?
Yeah, Turkey is a really interesting place to live when you're in the military. There's this, small base there, probably 3,000 or 4,000 airmen. And it was me and 2 other family med docs that were also fresh out of school. And they said, all right, these airmen are your responsibility. They call it a remote unaccompanied tour, meaning that you don't take your family with you there. So it's only active duty folks there. If people do have families, they're separated from their families for a year. Everyone's really kind of in the same boat. So you lean strongly on each other. And of course, medical problems happen there, and we were next to a big city, but ultimately we were kind of confined to that base. So it ended up being kind of an austere environment where anybody that got hurt or got sick, they'd have to come to the med group, and we'd have to figure out how to treat them, stabilize them, things like that, until we could get them to a hospital, which depending on other circumstances could have been right away or could have taken some time. So it was a cool place to start my career.
Okay. Do you find things there that you kind of miss, that you maybe would go back for?
Yeah, I think anyone that's been in the military can relate to this. When you're in that kind of setting, you form strong bonds with people that are kind of in the same situation. So some people call it trauma bonding. You went through a bad experience together. It doesn't have to be a bad experience. It was a good experience to spend that time with people.
Yeah. Did you like the Turkish coffee? Are you
I did. Yeah, it's a lot stronger.
Right.
We're used to these you go to Scooters or Starbucks and you get 64 ounces. Theirs is it's like a shot glass.
It's just like an ounce almost.
Yeah.
It seems like.
Yeah.
And the way did they prepare it with the sand and everything too? Did
absolutely.
You see that whole?
It's all silty at the bottom.
Yeah.
So the first time you take it, you just drink the whole thing back, and you don't realize that there's this like sediment at the bottom. It's kind of gross and gritty. And And then you realize, no, you're not supposed to drink the sediment. You're supposed to stop before you get to it. But
well, no, if nobody tells you that, what are you? I mean, you don't know.
But Turkish coffee, Turkish tea, kebabs, those are those are all great.
Was amazing.
Baklava.
Yes.
There's a big rivalry between the Greeks and the Turkish over who has better baklava. And I think it's the Turkish make theirs with walnuts, and the Greeks make theirs with pistachios.
Yeah.
It's all good. I'm not picking favorites.
Oh, I'll take the pistachio. I mean, I'm a walnut fan for sure, but yeah, the pistachio is just the best.
Right.
Well, what's something you took from your time as a military doctor that kind of shapes the way you practice today then? Did you learn stuff while you were maybe in Turkey or just in the military in general that now you bring into this practice in Box Elder?
Sure. Gosh, that's a hard question to answer. I think that when you're in the military, you're a doctor and an officer. There's a couple different hats that you have to wear. My job now, I see patients, I take care of patients, and I go home. In the military, you're kind of looked to as a leader as well. So you end up being in charge of a group of people and wanting to do what's best by them. So instead of just having this mindset of, taking care of patients, that's great. I have that. But I also take a step back and look at what's the best way to also make sure I'm taking care of other people and not only, for myself, do a good job of taking care of patients, but how can I improve this organization to make sure that that the organization sets everyone up for success to take care of people and then that people feel happy working where they're working as well. So there's a couple different hats that I had to learn how to wear. I went to school to be a doctor, not to lead people, but you have to figure that out as you go. And I hope that the people that I led feel like I did a good job doing it. I certainly enjoyed that part of the job.
Well, and you get to being an airman for sure, being out at Ellsworth, an officer out at Ellsworth. You get to. I'm sure this happens on most bases all over the country in the military in general, but you get to. You get to see what military families go through, right? The long hours and the moving and the separation and all of these things that people that live in and around Ellsworth, I mean, just in Box Elder in general, kind of get to feel as well. Does that, what you've seen in the military and what you experience there, does that help you connect better to patients too that you see here when they come in to talk to you?
Sure, absolutely. Box Elder's a military community.
Yeah.
Box Elder is not there if the base isn't there. And there really are some unique things that military families go through that, frankly, impacts their health. So I've really enjoyed being able to take that piece and kind of knowing what their unique needs are and just applying it to the practice we opened right across the street from where I was working before.
Is that how close is it just to Ellsworth?
30 seconds. You could run to the gate.
Now it's a brand new, isn't it, out there?
It is.
Yeah, that's all.
Yeah, I think they built a beautiful building there. It was really good timing for me that they were opening up the first clinic in Box Elder that wasn't on the base right as I was considering separating from the military. It's kind of nice to be able to just take everything that I was doing right next door, move it across the street. But I really think we've got a great leadership at that facility, a beautiful brand new building, and plenty of space to take on more patients, which I think is a really great service to the community.
It is. And I think it's something that was needed out there for sure. Because we're spread out here, obviously. You got Box Elder, you're like, oh, it's right over there. Well, it doesn't really feel right over there when you're sick.
Sure.
Right. Having to come into Rapid City or having to go, where the next closest one is. So, do you notice that? Are people? Are they grateful for having something out there like that and a doctor like you that's close?
Sure, absolutely. I think so. Credit to Monument leadership, whoever made the decision to build these new clinics. Monument was very centered in Rapid City, and Rapid Valley was growing out, and that takes a little while to get from Rapid Valley to downtown. Box Elder is continuing to grow. The base is expanding, so that population is going to continue to boom. And if you can't get on base and use the facility out there, there's nowhere to go for primary care without going into town.
Right, exactly.
And the other thing that I think people should know is the buildings that we built in Box Elder and Rapid Valley, they're dual purpose. So we do primary care out of them where you can have your normal, I need an appointment, I need to establish with a primary care doc, get me on the schedule. And then the other half of those is urgent cares where anybody who has a health problem right now, I can't get in to see my doc, it's too far to drive out there, I feel really sick, they can just walk right in and get care the same day. It
It is wonderful to see how Monument is growing. and expanding out into the places where the people are,
Sure.
right? Because it's hard. I mean, it's like you said, it's hard to get into Rapid City if you don't feel good. You don't want to go that far. Well, how would you kind of describe the kind of environment that you're trying to build out there then?
Yeah, I think that from the primary care side, I want to feel like people have a clinic in their community that's involved and engaged with their community, that understands the unique needs of their community, and hopefully to have a care team. Me and Dr. Roy Chelsea's our nurse practitioner out there, a team that is planning on sticking around for a while and being able to follow people. I think it's frustrating to meet a primary care doctor and, oh, just kidding, we're scheduling you with this person, but to have people like, hey, we're gonna be here. You can tell me your story. You're gonna be my patient. Every time you come back in, you don't have to start over. We're gonna build on what we do and utilize that to take the best care of you possible.
Well, then how important is that to you? I've talked with a few other doctors on this podcast, and I think that's becoming a bigger deal with a lot of doctors, especially the ones I've talked to here at Monument, is the ability to sit down with these patients and hear them, to listen to them, right? To not be like, oh, you're here, here's your checkup, I got to go to the next one.
Sure.
I got to move on. Is that important to you?
Oh, absolutely. I think that, in primary care for a long time, there have been a lot more patients than there have been primary care doctors, so we get a little bit outnumbered. And in order to take care of everyone, we have to avoid the tendency to dilute that care a little bit. Okay, I've got 20 minutes with you. Let's get going and let's do this. It's been nice in Box Elder since the clinic has kind of just opened up. The people that have come in and I've met, I've been able to spend some extra time with them because the schedule is not kind of one after the other. And I love it. Even when I do have 20, 24 patients on a schedule for a day, I don't mind getting a little bit behind to make sure that I know enough about you and enough about your story to really personalize your care and do a good job taking care of you. I think that's the power of primary care. We have all of these studies, all this data that shows that having a relationship with a primary care doc leads you to live happier, healthier, longer, and ultimately spend less on your medical care than you would if you didn't have a primary care doctor.
That's a big deal. It's just that ability to spend time with the doctor down the road, I think makes such a difference. Because these people, a lot of times, some people just want to feel heard. Like, yes, you're listening to me because this hurts. And you're not just telling me, oh, it's nothing.
Sure.
Right? You feel that way with your patients? I mean, obviously.
Yeah, absolutely. Yeah. I'm a numbers guy. I like statistics. One of the big statistics that has come out recently when it comes to how important is it to have a primary care doc, a family medicine doctor, not just go seek care when you need it, but have somebody that's focused on preventing diseases, counseling you on what could happen in the future. A person that has one appointment per year with their primary care doctor spends an average of $4,000 per year less on healthcare than someone that doesn't have that primary care doctor evaluated. It's crazy. I think we're the best value in medicine. I think that having a great relationship with a great primary care doctor, it pays off not only in health, but in how much we're spending on healthcare as well.
Right. Are there? Do you ever look back on your time, the 4 years that you served? Are there things that you really enjoyed about being in the military outside of being a doctor? I mean, because like I said, you're a numbers guy. You seem to be somebody who likes to follow the rules.
Sure.
Right.
Hope so. The rules, following the rules isn't optional. In the
right.
military.
Exactly. And you kind of have to respect that and enjoy that to be successful in the military. Do you think you ever could have gone beyond the 4? I mean, would you have considered it?
I think there were some benefits to it. I think ultimately for me at the end of the day is I didn't like the idea of them telling me I was going to move around every 3 or 4 years. I find, I just talked about how important it is to have a relationship with a primary care doctor. I think one of the things that it's tough for the military to do is to try to make those relationships when really the doctor's going to be moving every 4 years, the patient's going to be moving every 4 years. On average, if you're in the military, you get a new primary care doc every 2 years. I think that's tough for people. I think that's tough for doctors, and I feel like I can ultimately maximize the value that I bring to the community as a primary care doc if I'm in one place for the rest of my career.
Well, that's a really good point. I don't think a lot of people even take that into consideration. Yeah, of course, these guys are going to be coming and going.
Right.
And you don't really get to have a relationship with anybody at that point. Sure. It's hard just in the military alone, right? Well, what keeps you motivated to do this then? I mean, I think I've heard you say a couple of things, but do you get up every day and it's always a new experience?
Sure.
And you're like, yeah,
Sure.
I made the right decision.
Yeah, you asked me, why did you decide to do family med? Did you consider other specialties? Really, one of the things that's most exciting about family medicine is you never know what you're going to get. Specialists, I love them, I need them. They see the same thing over and over and over again. They get really good at managing a bucket of conditions, and I think it gets a little bit predictable from that standpoint. For family medicine, I'm going to see every organ system, complain on every organ system in the body every single day. So that variety is really exciting. I like being able to use everything I learned in med school, not like, this is the system that I work with now. I can't forget anything, and if I do forget something, it's not going to take very long before I have to look it back up because I've got to treat it.
Yeah, exactly. Do you? So how long have you been a doctor?
Sure. So I graduated from med school, got my doctorate degree 7 years ago.
Okay.
3 years after that, you finish your training, you do your specialty training, family medicine training, and then just about 4.5 years now. So I've been attending, fully trained, and all that stuff.
Even in this 4.5 years, have you seen a lot of advancements in not just technology, but in the approach to medicine too? Is that changing quite a bit?
Sure. I think our approach has stayed pretty consistent. I think there's some things changing kind of on the back end of medicine that patients don't see about how we take care of patients.
Yeah.
And, this goes from transitioning from fee-for-service to value-based care, which is a whole nother conversation. Those things are happening, but since I started medical school, I feel like I'm still pretty new doc, being 7 years out. Even since I started medical school, we have a lot of better ways to take care of conditions compared to when I started. How we manage obesity, for example, is completely changed. I know you've had episodes about the GLP-1s and all of that, but those are great medicines. They've revolutionized how we help people maintain an optimal body weight, which we know is hugely predictive of how healthy they'll be. How we manage diabetes, we can do that a lot more safely now. A lot safer medications that don't put people at as much risk for developing low blood sugar and things like that compared to before. So it's been exciting to see the advancements. There are some things that have happened that kind of make us be able to take care of patients more efficiently. AI is taking over everything. There's no exception to that in healthcare, where we'll utilize some AI not to make clinical decisions. We're still doing that with our heads, for writing our notes. You'd probably, if you've seen a doctor in the last 6 months, they've at least utilized some AI to make your note look good, to capture everything that they've done without having to spend 3 or 4 hours a day after they finish seeing patients to write their notes. So that's been a huge quality of life improvement for us.
Yeah. Well, you see in a lot of offices where there'll be signs now that says, there's a chance you're being recorded for use, whatever. I love it. I went all in on it. As soon as it became a thing, I'm like, I'm using every inch of this. Sure.
Yeah, I think people might be a little bit hesitant as patients to think that AI is being used as part of their medical visit, but I want to put people's minds at ease on that. We definitely make sure we're using these HIPAA compliant, patient safe, privacy is the number one goal when we're doing this, and it just helps us write better notes to take care of you better.
Yeah.
I feel like my memory is pretty good, but if we talk about 10 things in a visit, which isn't uncommon, I might forget some of that. And if I can kind of look back at the AI and say, oh yeah, we did talk about this, or oh yeah, this is what I mentioned, make sure I don't forget anything or anything like that. It's kind of a second brain to help me remember and ultimately take better care of people.
When you do you use social media very much?
A little bit here and there.
I like to ask you guys when you come in, because you get so much misinformation on social media. Is there any one thing that just drives you crazy?
Oh man, you're gonna make me pick one.
I know that's the impossible. I mean, or if you just pick from the many.
Sure.
But there has to be stuff as doctors that you're like, oh, I wish they wouldn't say that.
Sure. Yeah. Right? I don't want to get too controversial, but certainly there's misinformation kind of all over the place.
Yeah.
I think that COVID was an issue for us in the medical field, where it became politicized. People are getting information from this source and that source, and where I think that before healthcare was kind of respected as, hey, these guys really know what they're doing. They really know what they're talking about. If you listen to them, you're gonna do okay. I think that's still 100% true.
Of course.
But I feel like it kind of sowed those seeds of doubts into people. Oh, is this vaccine going to cause this bad side effect or that bad side effect? And without picking sides or anything like that. Just those kind of side eyes. Like, are you sure about that? Or so and so told me this. When it came to even the best ways to treat that, how should we be protecting ourselves from chronic diseases, and now even what's the best diet to eat?
Right.
We have some things that are coming out that definitely you should be doing all of this and shouldn't be taking any of this. It's saturated fats, not seed oils, or as absolutely this is what you should be doing. And really, if we had a best diet, we would have been doing it. It's kind of an individualized things where some people do a lot better if they're on that low carb keto type diet. Some people don't tolerate carbs at all. Some people need those, or they're gonna drag, feel low, and things like that. So I think we fight against a bunch of different things. But this vaccine hesitancy, especially as we see measles cases come back up, is kind of the thing that if I could convince everyone. And I truly believe it for myself. When my tetanus shot was due, I got it 10 years and one day after it was due. I'm practicing what I preach. But if we could prevent those preventable diseases with vaccines, I think that's the one thing that I would, if I could get everyone to agree to that, knowing that I have their best interest in mind, that's the thing that I would pick.
Well, and you went to school for 70 years to do this. I am too lazy to do that. So you know more than I do, right? You know more. I'm going to listen to what you have to say because you have gone and done all of the hard work at this point, right? So that's what I wish I could, or I do tell people. I'm like, they did all the work.
Yeah, absolutely.
Just listen to them.
Early on in my training, I had a wise doctor tell me people don't care what you know until they know that you care. And I think that's the power of family medicine is, hey, let's build that relationship. Let me ask you about your family, where you came from, what your goals are, what your priorities are, to really build that trust so that I can take care of you as well as I can. And I think that's one of the, talk about all of the things that make primary care so powerful. I think that's one of those things is having that relationship with someone where I want people to trust me. I'm not my only interest is taking good care of people. Right. These things you hear about, doctors get a kickback, they prescribe this med or that med. None of that's true. My only priority is taking great care of patients. Right.
Well, Dr. Larson, it's been great talking with you and getting to meet you. I'm so happy that you're out there in Box Elder. I think the community at large out in Box Elder is going to be pretty thankful to have you and the other doctors who are going to be there for sure as it continues to grow. Dr. Joshua Larson is a family medical physician in Box Elder. Thank you for coming in and talking, Doctor. And anytime you want to sit down and discuss Turkish coffee, Turkish delights, any of those things, I'd be more than happy to, man.
Perfect. I'd sit down with you anytime.
Thank you, Doctor. I appreciate it.
Hey, no problem. Thanks for having me.